You're 67 years old with a weak heart and blocked arteries. Medication after medication after medication. But you're still sick. You're short of breath, you're fatigued, and your legs are swollen. What should you do next? So Camille, tell me about this 67-year-old man with heart disease.
So he was diagnosed with blockage in the arteries ranging from 40 to 50%. He had atrial fibrillation that had been treated with a procedure called a cardioversion, and he had heart failure, so his heart was squeezing around 40 to 45%. Despite the intervention for the atrial fibrillation, he was still having severe fatigue, swelling in the legs, and some chest pain and shortness of breath. And his doctors were just adding more medications because he didn't quite qualify for surgery for the blocked arteries. And so he's on a blood thinner and 5 heart failure medications. But despite this, he didn't feel any better.
So as you describe it, look at his medication list. This patient was a very sick patient. He was on all of the guideline-directed medical therapies. He did not qualify for surgery because he didn't have enough blockage for surgery. However, he had too much blockage for his heart to function normally. And having arrhythmia like atrial fibrillation could also complicate things. So he needed an alternative approach. So what were some of the findings in this patient on his evaluation?
So his echocardiogram showed weak pumping of the heart and increased pressure in the lungs because of the weak heart function. It also showed high inflammation in the heart and the arteries, which increases the risk of death. And there was a high marker that indicates plaque formation and propagation called trimethylamine oxide. And furthermore, his bad cholesterol is extremely high.
These are interesting findings because what this tells me is that this patient has lots of abnormalities at the cellular and tissue level. So in my opinion, we need to treat this condition at the cellular level, not with just medications, which work superficially, or surgeries, which also work superficially. So Camille, how did you intervene with this patient?
So I worked with the kitchen and the culinary team, and we prescribed an anti-inflammatory and antioxidant diet. So the first 3 weeks consisted of food levels 0 to 4B. After that was food levels 0 to 6. We also weaned the diuretics and eventually weaned off the heart failure medications. And we also did targeted supplement therapy based on his condition, and that consisted of liposomal CoQ10, micellized vitamin D3, and also consisted of vitamin C.
Yeah, I noticed that you talked about the precision of a nutritional regimen. Food level 0 to 4B, and then eventually food level 0 to 6. Many of you are not aware of our food classification system, but we use a food classification system level 0 to 10. The lower the number, the healthier and more impactful and nutritious the nutritional regimen, and the higher the number, the least. We never prescribe above level 6. Numbers above level 6 are unhealthy. For more information on our food level classification system, see the link below. Also, the other important thing is that you use target supplementation. Once the optimal nutrition started having an effect at the cellular level, he no longer needed the medications, and he started improving right away. So I thought that was a very important approach to take. So how did he do?
He did great, and his energy levels skyrocketed. His swelling in the legs went down significantly on his physical exam. He wasn't having chest pain anymore. And on his blood work, all of his markers improved by 35 to 50% about.
Wow.
And then the pumping of his heart went up by about 10%. So his heart was pumping stronger, and, he's feeling a lot better, I think, not just because of improved heart function, but because of getting off those medications that were causing a lot of adverse effects.
So what time period did this occur?
A little bit over 4 weeks.
Wow, impressive. So again, as I pointed out earlier, this patient was symptomatic because of what was happening at the cellular level. With the nutrition and target supplementation, we corrected things at the cellular level first. Once you correct things at the cellular level, everything else improves, and it doesn't take long at all. So I hope this was helpful to you. And of course, as always, if you have questions or comments, leave them in the comment section. And until next time, take care.
Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.